Welcome to Reimbursement Rx weekly update, and I'm Dr. Lekowski. In the recent poll, it was found that nearly 50% of Americans are having a very hard time affording the health care, such as paying for their prescription drugs, paying for doctor bills, or hospital bills, or any services that revolve around health care. 49% to be exact. And some might say, well, that's not so bad. You have another half who can afford it, but this is a very dismal number for a country as big as ours. Basically, for a typical family of four, half of them cannot pay for their health care. So what can be done about it? What is being done about it? Well, right now there are a few things that, as we speak, our government is trying to push, or trying to do something in order to make this problem better. First of all, I don't know how many of you know about the GAG Act that pharmacies are currently exercising because they're prohibited. That's right. Your pharmacy is prohibited to tell you that sometimes a cash price for a drug is cheaper than price paid using your insurance. You may have to pay $20 copay for a simple generic medication where a cash price would be a fraction of that, $3 to $5. Now you can still pay your pharmacy that, and you can not tell them that you have insurance, that you have health insurance, but they are currently not allowed to tell you that. Well, as we speak, the Congress is battling this gag clause, and hopefully it will be discontinued so that at least prescription medications, generic medications, should become even more affordable. Now, speaking about prescription medications, you may have heard that Pfizer, one of the largest pharmaceutical companies in the world, earlier this year said that they are not going to increase their prescription drug prices. Well, that is really good news. And just earlier this week, Novartis, another huge pharmaceutical company, followed suit. They also said that they're not increasing prices for their prescription medications. Now, does that mean that they're lowering prices? No, not at all. It just means they're not hiking them a little bit higher. Now, that is also partially good news because some of those medications will be not less affordable, but at least this is a step in the right direction. And also, at the present time, there's a motion in Congress to establish something called Medicare for All. Medicare for All will mean single-payer system where everyone from age 0 to whenever you pass have access to Medicare. In itself, this is something that sounds absolutely wonderful, something that sounds great, and will provide access to healthcare for all, regardless of your income level. Now, critics will say, well, if we have one-payer system, it means that we all have to go to the same doctors, or we all have to follow some sort of a government's guidelines, and care becomes rational. Well, a one-payer system does not mean that you cannot have other forms of coverage. It does not mean that you cannot have private health insurance. It just means that the vast majority of people, those people who cannot afford their health insurance, now they'll have an option to be covered from the government's overall one-payer system. Now, one-payer system, single-payer system, does not equate universal coverage. It just means that more people will be covered. And while the details still have to be worked out, while the price, which is likely to be in the trillions, still needs to be worked out, at least the fact that they're working on it, at least the fact that they're doing something about it, speaks volumes to that fact that the way that the system is right now, the way how Americans are being covered, and the way that healthcare spendings are going is not going to be sustainable, and something needs to be done. Let us know your thoughts, your comments, and how you feel about the problem. I'm Dr. Lekowski with Weekly Update from Reimbursement Rx. Thank you for watching.